The National Treasury and the Planning Cabinet Secretary Ukur Yattani has announced that they are set to launch the country's first comprehensive insurance cover for civil servants and the National Youth Service. Anita Nkonge with more.
It is no longer a question of if you know somebody who has COVID-19, but now a question of what medical cover there is in the event that someone gets the disease, which has become more prevalent. The COVID-19 pandemic has, if anything, highlighted many loopholes that were once not noticed. Loopholes like comprehensive insurance cover at a time when many fear the COVID-19 pandemic that has stopped the world in its tracks. Medical insurance to cover the pandemic-related treatment is not guaranteed for the citizen at the moment, but soon civil servants, along with medical workers and members of the National Youth Service, can expect some cover. This is after Cabinet Secretary for National Treasury and Planning, in a statement sent out to newsrooms, announced that they are set to launch the very first comprehensive insurance cover for them. This is expected to include a COVID-19 cover for all medical personnel as well. It comes at a time where disgruntled frontline medical staff have raised concern over what they call negligence by the government to protect them, particularly during this COVID-19 pandemic.
Governments across the world have come out in full support of their healthcare workers. In our country, the neglect and working environment has resulted in the loss of now over 30 healthcare workers. There have been bills of up to 2 million of ICU care of healthcare workers. Those bills have been sorted through fundraising by all healthcare workers, not the government.
The healthcare workers in their demands want adequate personal protective equipment and a comprehensive medical cover, amongst other terms. And rightfully so, as infections are increasingly exposing them further in their line of duty. Just today in Kakamega County, 102 healthcare workers tested positive for the virus.
Wagonjwa ambao wanakuja kwa hospitali kupata matibabu, sio rahisi kujua kama ako na COVID. Wanamtreat kama mgonjwa mwingine yote. Alafu after a few days, pengine after admission, samples zimechukuliwa, ndio itagundulika yeye alikuwa na suffer from what? Hiyo COVID-19. So by then ashatangamana na wafanyikazi wa hospitali, pengine ashawaambukiza.
Bomet County is the latest county to have its healthcare workers go on strike. The others currently on strike include Nyamira and Migori.
We don't like strikes, but we are forced to go on strike. We have tried all the available options. This is the only resort that now we have. First, to protect these doctors, and secondly, to protect their families, and also to protect these patients that come in this place.
The Meru County Government Headquarters is closed until December the 7th after staff tested positive for COVID-19. This is just a day after Kirinyaga closed its county headquarters over COVID-19 concerns as well. Clearly, the counties now have to be more deliberate in their response to the pandemic, as projected by the Health Minister on Monday.
The County National Emergency Response Committees on COVID-19, co-chaired by governors and county commissioners, should hold emergency meetings and immediately start considering county-specific surgical measures to curtail the spread in the respective counties.
Anita Nkonge, NTV.